Assalamu alaikum dear doctors. In this video I am discussing a communication that is intraventricular hemorrhage. It is a breaking bad news or can be consent. So as usual I introduce myself, attend and repo and previous knowledge I ask. Now call rule like. After doing a jelly scan of Adam, we found that he has what we called intraventricular hemorrhage. Do you have any idea about that? Then look the image. I draw this image and am explaining. Actually, intraventricular hemorrhage (IVH) is a bleeding into the fluid-filled spaces as he born before date. His blood tubes not mature enough, so fragile and rupture and make bloods in water spaces. Am I making myself clear? The next question: Why you suspect and do scan, doctor? Usually, no signs appear. All babies born before their date, it is less than 32 weeks, we do head scan in first week of life routinely. Next question: Is this scan safe for my young babies? It is done easily at bedside without risk of any radiations. So, soft spot on baby's head and it is similar to the one used for pregnancy scans. So next question can be asked like, is this scan can see how brain work? Yeah, I understand your concern. I appreciate your questions. Actually, no. It usually assesses the structure of the brain and water spaces but not function. Next question is that, is it serious, doctor? Let us hope the best for him. It has some drawbacks. These are, it can affect the development, it can affect the hearing or visions, movements and increase the head size. And it has some grades, that is 4 grades. Number 1 grade is best prognosis and number 4 is the worst prognosis. And number 3, no specific treatment for the bleeding. It stops usually by itself and improves gradually, so we have to regularly repeat head scan and measure head size. Grades 1 or 2. Now, may need surgery, but best who can discuss this doctor specialized in nerves. So grade 1 and 2 treatment is that, and then grade 4 may need surgery. Now the grader describing grade 1 is minimal, grade 2 is bleeding increase but there is no dilatations, grade 3 there is dilatations, bleeding in the ventricles, and grade 4 that is outside occur the bleeding. This grade is for the colleague or any medical student when described we tell that. Then as usual summary, support group and the leaflet, important website address, everything I will give. Again the intraventricular hemorrhage, that is on ethics communication come. So I am telling the grade 4 and his condition is bad. Discuss withdrawal of the care. First as usual introduce and repo in prior knowledge and clarify the rule. Explanations. As you know, he has bleeding in his brain in water spaces because he born before date. And now his condition is very critical and we decided to withdraw care of him. Benefits. Actually his condition is critical and this bleeding has effect on many systems in his body like heart, brain, kidney and gut. His body no longer be able to fight against this. Next question, why did not give him all treatment? We already have spent our maximum efforts trying to survive him, but we are just prolong his and your suffering. Question, who decide this? So he has assisted by the most senior doctor and the team. How you will stop the machines? Medicine is stopped first than the machines. I can offer you to spend time with him so you can hold him. Summarize leaflet, support group as usual. To colleague, ethical dilemma, framework for gray zone, autonomy. Do you think who have the right to decide? Their parents, and this is the first item in framework. Beneficence. There is some situation in which limited of care is the best interest for him, and when 3 will not prolong his life significantly. When stage 3 will not alleviate the burden. When no hope and no chance, and when child is competent and can consent for withdrawal. Non-malfeasance. If he kept on care and machine, this is just prolong his suffering and efforts in family if he become ventilation dependent all his life. Justice. According to our resources, if we have two patients. One will not benefit from ventilations and other will no benefit. Who will you choose? So, who will take the decisions? By the multidisciplinary team and the family members. We'll kill him. We'll do palliative care for him. So, autonomy, then benefit versus risk, then best interest and justice. We are seeing that. Then at the last, can you summarize to me? I will give you a trusted website. We can do a seminar.